You've talked about hands-on patient-facing roles. So I have to ask you, are prescribing pharmacists just low-budget alternatives to doctors?
If we let it, maybe, but I certainly would say to you, let's not let that be the case. I am not a doctor. I have perhaps never really wanted to be a doctor. I'm very proud to be a pharmacist. And I believe that my strength to the multidisciplinary team is not as a little mini registrar or a junior doctor, it's a pharmacist. Because what I bring to that team is very different. You know, my way I assess a patient, the way I prescribe for a patient, although there's learnings and there's a lot of overlap, it will be slightly different. And that's what you get by employing a pharmacist as part of the MDT. Very different from a mini registrar.
And my last question, do you have a closing message for pharmacists who might be thinking about working in respiratory medicine?
Well, I'd obviously very biased. I've worked in respiratory for 25 years, but I think respiratory offers a lot of opportunities, and I've discussed some of those already today. So not only, you know, your skills are transferable wherever you work. So if you've decided to work in community, GP practice-based pharmacy, you know, hospital, CCG, industry, wherever you wish to work as a pharmacist, your skills that you develop as a respiratory pharmacist will work across the patient pathway. And I think that's important. We should be following that patient and utilising our skills that way. I think also, remember, respiratory is not just asthma and COPD. You know, there's over 200 different interstitial lung diseases. You've got cystic fibrosis, bronchiectasis, pulmonary disease, in terms of pulmonary embolism and lung cancer. So there's lots of different areas that you can get involved in, and it isn't just around just asthma and COPD. And often allergy and immunology is also attached to respiratory as well. So that gives you a vast you know, opportunities to work in different disease areas. And then I guess finally, I find respiratory clinicians and the MDT extremely welcoming for the role of the pharmacist. You know, I think that generally very nice people to work with, and also there is great support sort of nationally with you know, bodies like the British Thoracic Society, like the Primary Care Respiratory Society, you know, working very much around trying to help us to promote our role. So we've got good support in the area. And I think at the end of the day, our role as pharmacists are valued by the clinicians and the rest of the MDT. But do you know what is important to me? I think our role is extremely valued by our patients.
Dr. Anna Murphy, thank you for sharing your experiences and insights with us today. That really has been inspiring. For more information about Dr. Murphy's work, please visit our website using the link in the description, and be sure to sign up for more news, videos and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.